Hi, I'm Liz, CEO and founder of Worth It. Worth It specialises in early intervention and prevention of mental health problems in children and young people using positive psychology and coaching psychology approaches. Why do we need to do early prevention? I was looking at some statistics the other day and I actually really read them and computed them because I see these statistics all the time and I live and breathe this every day. And sometimes I think I'm too immune to it, I'm too used to it, but it's actually shocking. Nearly a third of 16 to 24-year-olds, 31% have evidence of some symptoms of depression and anxiety. And when we want to do early prevention, we want to prevent those early symptoms getting any worse. We also want to prevent them getting symptoms in the first place if we're talking about total upstream early prevention. And this is up from the first year. But the thing about those statistics, the second one I'm talking about, these ones, is they're from 2018. So they predate the pandemic. We know that the pandemic had a massive detrimental effect on young people's mental health and well-being. Also, from the latest statistics from 2020, that 1 in 6 children and young people aged 5 to 16 have a diagnosable mental health problem using the SDQ as a measurement instrument. So there is really no real, like, these are subsections of population that are doing these surveys to get these statistics. So it's really impossible to survey every single person in the whole of the UK and assess their well-being. So this is just kind of, then they extrapolate it up. So it gives you a picture, but you know from your own experience of working with young people that there are more young people with problems, more children and more young people with problems. So, yeah, there's a huge tsunami of problems that are coming towards us and getting worse. And what we also know is that experience of childhood trauma doubles a young person's risk of experiencing a mental health problem. And we have all been through a collective trauma with the pandemic 2 years ago now. So there's a need to put in protective factors for young people. And we'll talk about why adolescence is key and why, if we can use wellbeing strategies in young children, pre-adolescence, they're going to carry them forward. So yeah, so the scary thing is, like, 1.5 million young people will develop a mental health problem in the next 3 to 5 years. 1.5 million. That's just in the UK. So if you're international, I don't know what the statistics are internationally, but it's pretty bad globally. This is just an epidemic problem. They say that depression is going to be the biggest public health issue to overtaking heart disease in the next few years. It is significant and severe, and partly it's because the way we have constructed society means that it's contributing to a lack of well-being, but because we're not explicitly and implicitly embedding well-being into people's everyday lives and experiences, they don't know how to do it. We just assume if you're lucky you can develop well-being. It has to be explicitly and implicitly taught, and how I believe that is through coaching-based interactions and programs and things like that, which I'll talk about. So one of my inspirations for my work is Professor Corey Keyes, is a sociologist in America. His work is amazing, and he's developed the dual mental health model that basically says the kind of misconception that mental illness and mental health are on one unique spectrum is wrong. And it's actually on a dual continuum like that. So we need not only do we need to reduce illness, we need to increase health and move people towards flourishing. And that's what I'm talking about in our work, is using coaching and positive psychology interventions, programs and ways of working to increase strategies for health. Because what he says is, we know that the loss of mental health causes mental illness over time. If you lose health, it causes illness. People use the language of mental health and mental illness interchangeably, meaning to mean the same thing, and they are not the same thing. They are two different things. I have a massive issue when people say, you know, at the end of EastEnders or something, and they say, oh, if you've been bothered by mental health, call this number, call the BBC Action helpline. They're not talking about mental health. They're talking about mental health problems, but everyone deletes the word problem off the end. When we talk about mental health, we should be talking about positive mental health, well-being, and a move towards flourishing. So I tend to use that language and terminology interchangeably to mean having mental health. So we have to protect and promote strategies for health. So we must complement treatment. So we know that there's a lack of treatment for young people, which is contributing to this huge issue in the UK around wait lists being, only like 1 in 4 people that gets referred to CAMHS gets access to CAMHS, and the threshold's getting higher and higher and higher and higher because they just can't meet the demand of this massive amount of young people with issues. So we have to complement treatment with protection. And if we can promote, then we can protect people from becoming mentally ill in the first place. So that is what I'm talking about today. That is why we need to do this. So, but there's no real investment in this, in promotion and protection. You might see the odd like public health campaign, like 5 ways to wellbeing. So that is a promotion, a mental health promotion campaign. But it's like, there's no accountability to actually do those things, to actually help yourself. So that's where coaching can come in, because coaching is about helping people take personal responsibility for looking after their own well-being. I think people can think well-being is done too. We just do too, and you absorb it. But it's a proactive, dynamic process that you have to engage in. And you have to hold yourself responsible for. I often say it's like if you go to the gym and you do 1 press up and you're like, where's my 6-pack? Where's my guns? It's not going to happen, is it? It's like going to Weight Watchers one time. You can't just do one thing once and expect it to change and expect it to work. And well-being is exactly like that. Promoting mental health is exactly like that. So this is also interesting in regard to the schools sector. So Mind did a report, Not Making the Grade, and they surveyed secondary schools, 1,271 young people, as 96% reported that their mental health had affected their schoolwork at some time. So if you're looking for evidence to say to people in your school that mental health problems are an issue, there's a nice statistic for you, because some people won't believe you. Colleagues will be like, no, it's not an issue, or because they don't want it to be, because they don't know how to deal with it. It's difficult. This is really, really difficult and scary and frightening for people. So they will avoid it, and they will have cognitive biases against you and this kind of thing. 78% of young people said that school had made their mental health worse. And we know from the research of Sarah Jane Moore that GCSEs and exam stress is a massive contributing factor to mental health problems in teenagers. And really, during that developmental stage of brain development, we shouldn't be testing them at all. That's a whole nother ballgame, and I'm only a cog in the wheel, and I can't change the education system, unfortunately. I can only contribute to my voice to helping increase capacities for wellbeing, helping practitioners increase capacities for wellbeing. 56% of school staff identified that young people who didn't receive support self-harmed. So the lack of support is contributing to more issues, and young people searching for negative coping strategies such as self-harm to cope with the amount of pain, emotional pain they're in, really. So self-harm is a coping strategy. It's just a really harmful coping strategy. 48% of young people told us they have been punished at school for behaviour that was caused by their mental health problems. So then it's just building on it, and they're feeling worse and worse about themselves. 25% of school staff said they were aware of a young person that had been excluded because of mental health problems, and 70% of young people who experienced racism told us it had impacted on their wellbeing. And we know racism is a trauma that can contribute to more mental health problems developing. So that's scary, those statistics, aren't they? Pretty scary. So because of all of that, a couple of years ago, the D4E issued this guidance around taking a coordinator. So this is specifically for the UK, England, taking a coordinated and evidence-informed approach to mental health and wellbeing in schools and colleges leads to improved wellbeing and student engagement, which can help improve readiness to learn. So with the Department for Education, I know that improving mental health and wellbeing at school is really important, but how do you do that? And this isn't about just making it easier to refer into CAMHS. That is one part of it, and that does need to happen, don't get me wrong, but there is just not enough capacity in the workforce. And even if the government said, here's £5 billion, they still won't be able to recruit enough people quickly enough and train them up quickly enough to provide enough support to deal with all the mental ill health problems. I went to a workshop years ago, and it was one of massive inspiration for me because I got so angry, and it was like a kind of consultancy forum thing for providers, and they were saying, there's such a massive issue around recruiting for the CAMHS workforce. It's going to take at least 10 years to recruit a workforce and train them. And that was 12 years ago. And they've not recruited that workforce. In fact, they've reduced that workforce. And then we've had a pandemic. So it's just the demand is not meeting supply. I'll get off my soapbox about why we need to provide prevention. So what do we mean by prevention? There are different types of prevention. And if you've seen my work before, you'll see me talk about the using the river as a metaphor. It's a famous metaphor that we use in prevention. So instead of letting people fall in and fishing them out the end when they're already drowning, we are stopping them falling in the river in the first place. So we have downstream, which is also called tertiary prevention. So sometimes I use those terms interchangeably, but in the sort of occupational health or clinical world, we talk about tertiary prevention, which means that someone's already got an identified need and we're trying to stop them getting any worse. So somebody might have severe, they might have symptoms of anxiety and depression, they might have some other, developing mental illness or mental health problems, and that we want to stop it getting worse. So that is not what we do at Worth It. We don't really do tertiary downstream prevention. We do mid and upstream prevention. So midstream is secondary intervention, which is about supporting aims to mitigate the effects of harm that have already happened to at-risk cohorts. So your at-risk cohorts might be your young people or your children that have experienced an adverse childhood experience, which there's a whole list of adverse childhood experiences: racism, bereavement, drugs and alcohol misuse of within the family, abuse, being from a refugee, being from a war zone, like things like that. A lot of young people experience a childhood trauma, family breakdown, and what we need to do is put in protective factors to increase their well-being and resilience during that time, so that we stop the impact of that adversity causing more harm. So you're noticing already a cohort of young people that might need help. Young carers are a particular area that I'm passionate about supporting, not only because I was a young carer myself when I was younger, but also because they are the most amazing and wonderful, resilient young people and children, and they are massively under supported, and they are so at risk, especially if their parent has a mental illness. They are 70% more at risk of developing a mental illness themselves if they're a child of a parent with a mental illness. Upstream, and then we have upstream primary prevention, which is to support harm before it happens in the first place. And this usually occurs at a systems level. So this is where your whole school approach comes in, or your whole population approach, or your public health campaigns, or your community interventions, things like that. So at Worth It, we create and deliver, and I've created and written and worked with schools and organisations to deliver primary and secondary early intervention.